Hi, my name is Helen and I live in Hillsborough.
So, Helen, tell me this. When you very first came in here, what was your major complaint?
I had significant lower back pain in the L4, L5 area, and it caused me to not be able to walk normally. I had a lot of sciatic pain as a result of that, and was generally in a great deal of distress.
Good gosh, and how long has this been going on?
Well, off and on for a few years, but it certainly became aggravated in the last year before I came to see you.
Right. What sort of things were you having trouble doing?
Well, as I mentioned, walking, but because it was such an ongoing distress, it impacted on really every part of my life. I'm a chef and I had trouble standing very long. I had been a landscaper, was no longer able to do that. Sleep was interrupted.
Yeah, you told me you were exhausted all the time.
Mm-hmm.
So you were basically a mess.
Mm-hmm. We could call it that.
Okay. Well, now we've been doing spinal decompression therapy. How's that been working out?
It's been a lifesaver. I don't get up every morning now wondering how I'm going to get through the day and what parts of it are going to be compromised and whether or not I need to delete this and that. I don't think in those terms any longer. I think in terms of, oh, be sure to do your morning exercises and maybe another one in the evening if you're able, because that really is a mainstay. It's significant that you do that, and I recommend it to anyone who starts this program, that they listen carefully to those exercises which seem like so little in a certain way, and yet they are really not. They're part of a larger maintenance program. So it's been a lifesaver, and for that I'm really very grateful. But I also want to say that it's the right treatment that I was finally able to find for my condition, because I'd been through all manner of other routes.
You'd had physical therapy,
Chiropractic, acupuncture.
You did
Yes.
everything.
I did everything that I knew to do and that was available to me. And when I came to this area a year ago and was able to find this, I had the sense that it would be a right place to go, and it has been.
Good. Well, it sounds as though you would recommend spinal decompression to others.
Yes, to anyone who had a similar situation to mine that was chronic, and they were clear that they didn't want to think in terms of having to have an operation in order to relieve.
Because that was
the
your
pain.
next step, wasn't it?
It was, yes. My brothers, a few of them, have had that, and it hasn't gone well for them. So I knew I didn't want to go there. Come and give it a full chance.